Who are you? What's your, really what's your superpower, and why should you win this award?
So this is Jay Pandit, the Chief of Clinical Strategy at Bodyport. Bodyport is a congestion monitoring solution, which is a hardware software platform that we have. We know that 25% of all hospitalizations are caused by congestion that leads to symptoms, and so that's what we're trying to crack at. Our solution is FDA approved, and in our larger multi-center study, we've demonstrated that we can actually detect congestion 2 weeks prior to actually weight, which is known as a lagging indicator. And the plan here is to go and expand into a disease, go start in CHF and then go down the pathway of CKD and other disease solutions. And so excited to talk about it further.
What you described earlier, 25% of all these visits are being caused by congestion that ultimately leads to these symptoms. So, and you proved you can detect 2 weeks in advance. That you can detect this 2 weeks in advance. So give us the impact. Where have you seen this already making an impact on care?
No, absolutely. So I can give you a specific case, but one thing I didn't get a chance to say was the superpower here is really the simplicity of this platform. It's the form factor is a smart scale that's taken to the next level with 3 different sensors within it. And the person just has to stand on it for 20 seconds and you get an impedance reading along with a heart rate as well at the same time. So, one of the things with patients who have multiple comorbidities is really figuring out whether they're wet or dry, whether they have too much retention or not enough. And so in this scenario, we had an 81-year-old participant who was in our studies, who was cachectic. So she was continuously losing weight, giving you the false impression that she was actually not retaining fluid, when in reality, the extracellular water was actually going up, and she would end up with heart failure symptoms and end up in the hospital. And so in this scenario, we were able to intervene again about 10 days before, alert the care team to start diuresis. And this can be also one of the things that we want to do in the application in the CKD space is, again, reduce, as Adam pointed out in healthy.io, reduce the number of people that crash into dialysis. If we can actually find folks who can ease into electively go into dialysis, that's a much better cost savings.